I often do what I say is double talk, where I will use the technical medical language, but then I'll follow it up with more of a layman's talk. And so therefore I don't assume whether you know it or not. And so I just make sure that I'm talking in a manner that everyone can understand. I make sure I use a lot of drawings and diagrams to kind of explain things. I'll also use a lot of the lay terms, like if you talk about diabetes, it's sugar, type of things. Or, I'll use multiple terms to describe your rescue inhaler. So, instead of saying albuterol, I'll describe it by the color, so the orange or the little red one with the numbers on the back or type of thing. So I make sure I'm able to kind of reach a larger demographics. And I find that even if you have high educational attainment, those patients usually aren't offended by me describing their inhaler by color, because they they just appreciate that I'm relatable and I'm not talking in some esoteric language that's specific to pulmonary providers. So I think that's one of the biggest things that providers need to do, is making sure that your patients understand what you're saying. And then one thing that a provider can also do is ask your patient to describe back to you what you're saying. Because even though I am a health equity expert, even though I try to make sure my materials that I hand out are at the appropriate health literacy level, and I make sure that I kind of use examples to represent numbers and things like that and percentages, patients still may not understand what I'm talking about. I'm from New York, I talk fast, type of things. And so, it's important to also check with the patient, ask them to explain to you what you actually, describe to them. And so that is a way that I kind of check myself and make sure that I'm actually doing an effective job at communicating with my patients.